Good morning to everybody. Good morning to the Honorable Health Ministers. I'm going to keep this short because I can see somebody is waiting here to crack the whip. It's my pleasure to talk to you today about Biocon Foundation's primary and preventive healthcare programs. This foundation is a 12-year-old foundation, and for the last 12 years we have been focusing on strengthening preventive health practices and creating a robust primary healthcare system. As healthcare providers, all of us in this room, we must provide relevant and impactful programs that help prevent infections and that facilitate early detection of chronic diseases. In addition, primary health clinics must be single-point treatment centers. They must be accessible and they must be of the highest possible standards. And most importantly, we feel, records must be captured and documented very systematically. A state like Karnataka has more than 2,000 primary health centers. And as in most states, these primary health centers see a very, very high patient footfall. Some questions that we must ask ourselves is, how can we ensure a high quality of care in these centers? How can we monitor and track our patients? Are our patients complying with their medications? Is their health improving, or are they coming back with the same symptoms and the same complaints over and over again? Do they have diabetes? Do they have high blood pressure? Do they know that they have these conditions? Do they have recourse to good follow-up, say after a heart surgery? At any point in time, PHCs in our country have to look after 50 to 200 ANC cases. How can we support these institutions to do this effectively? These are huge challenges, and if any of you are in the field as much as we are, you will see that the government has it's a Herculean task to provide effective healthcare to these patients. And I bow before any government that does this, because it's really a thankless job for them. Most of these questions that I have asked can be answered if you adopt a data-driven approach to primary healthcare. And this is what we have tried to do in Biocon Foundation. We have developed what we call the eLAJ Smart Clinic model. This model combines an EMR which has been developed specifically for primary healthcare, and it can be installed in any primary health center in the country. A short summary of what eLAJ does. It digitizes the patient records of each and every patient who comes to our clinics. It also integrates health camp data. So if a patient has come for a health camp, she has the same ID that would link her health camp data to her primary healthcare data. Each eLAJ clinic has 3 interconnected modules. We have a registration module, we have a clinical consultation module, and a diagnostic module. These 3 modules talk to each other, and we have an intranet in the clinics, so case files go very smoothly from the registration counter and to the lab. We can also build in telemedicine into this system for specialist consultation. And the system can be integrated with a hospital EMR. What we are very proud of is that eLAJ provides live dashboards to the health administration. So on any day, the health administration can see what their patient footfalls are, what their monthly patient footfalls are. They can see the disease profile of a community. They can see the disease trends in a community. The dashboard can provide a listing of patients who have high BMI or have low BMI. So this facilitates follow-up by the ASHA workers. And everything becomes easier, it becomes more transparent, and it becomes more systematic. Currently, Biocon Foundation is running 2 public-private partnership programs with the government of Rajasthan and the government of Karnataka. These are slightly different because in Rajasthan we have adopted the primary health centers, and we've taken over the complete management, called the EMR, and we've installed diagnostic centers within these PHCs. In Karnataka, we have not adopted the primary health centers. We've installed our EMR in the government primary health centers. And we've rolled out this program from March, and we will be very soon giving the government administrators live dashboards for their clinics. Other programs that we do, which we integrate with eLAJ, is we help communities manage chronic diseases. So we have a mobile health program that detects oral lesions. We work in cervical screening with many tertiary partners like the Mazumdar Shaw Cancer Center, St. John's Hospital, and different hospitals in different districts. We do breast health screening with UE Life Sciences, who is here, and I'm sure they'll tell you more about that. And we also have dedicated NCD clinics which are anchored in our primary health centers, where we get either doctors from tertiary centers or we get our own doctors, and blood sugars of diabetic patients or hypertensive are measured and monitored, and we bring in specialists in retinopathy, in foot screening, and we also provide patient counseling. That's it from me, and if anybody wants to know more about eLAJ, my colleagues are there at the stall, or if you want to know anything more about Biocon products, we have a stall here, and please do come and ask us. Thank you.